Are tens of millions of people really about to lose their health care? Yes. All of this is happening very soon, and it's all going to happen in one committee. The committee is Energy and Commerce. I'm on that committee, and we're about to have the debate. Are they going to start the debate and say, we're about to cut health care for tens of millions of people? No. Here are the three things that they're going to say. Number one, they're going to say Medicaid, which provides health insurance for 70 million Americans. Let's kick it to the states. But the fact is that the federal government covers 70% of Medicaid. The states do 30%. When you kick it to the states, they're not going to be able to cover the gap. So if you hear we're going to kick it to the states, that means they're going to cut healthcare. Number two, work requirements. Fact is, almost everyone on Medicaid works, and if they can't work, there's a reason. Congressional Republicans know this. They've tried this in a couple of states. It hasn't worked. But what has worked is that people have a hard time with the paperwork. They get stuck in the bureaucracy, and they lose their coverage. These are people who are already working. They're in school. They have a disability. They still lose their health care. Number three, this is the biggest one. They're going to say we want Medicaid only for the people who really need it. In fact, and this is a direct quote from the speaker, they want to keep Medicaid for people who have real disabilities as opposed to the people who have fake disabilities. So what they're saying is that Medicaid has expanded to cover more and more people over the years, and they want to take away the health care of those 20 million people who get health care through Medicaid. Here's the thing. Most people don't care where they get their health care. They just know they need their health care. And but for us and winning this fight, they're going to lose their health care. We expanded Medicaid to include tens of millions of people who can't get it anywhere else. They can't get it through their work. They can't afford it privately. And so they get it through Medicaid. So when you hear Medicaid, think health care. It's health care. It's health care for tens of millions of people. When you hear kick it to the states, that means they're going to cut healthcare. When you hear work requirements, that means they're going to cut healthcare. When they say we're just going to focus on the most vulnerable, that means they're going to cut healthcare. They're cutting healthcare for tax cuts for the super wealthy. Meaning that if they don't extend the tax cuts for the super wealthy, they don't have to cut anyone's healthcare. I'm going to be in the room for this fight, and I intend to do everything in my power to win it. The more they hear from you, the more likely it is that we win this fight and everyone gets to keep their healthcare.